Well, I think this is a very relevant question. Major depressive disorder is a very highly prevalent disorder, affecting about 5% of the adult population in the last year. So meaning really, more than 800 million people being affected with depressive disorder. However, we talk about depressive disorder as being one thing. And I think we realize more and more that depressive disorder is actually a very heterogeneous condition. Heterogeneous in the fact that the driving etiology can be very different for individuals, but also the symptom profile can be very different and the pathophysiology can be very different. And I think we are very much aware of that because we see, for instance, in bigger research projects, that there are people that have a definition of major depressive disorder, but if you then compare individual persons, they actually have hardly any overlap in the type of symptoms they have. And also in our research projects, I am the principal investigator of the Netherlands study of depression and anxiety, which is a study where we study the heterogeneity of depression. We came to realize that there are people that are quite different in the expressions of their symptoms. And also if you then look at their pathophysiology, we see very strong differences also. And one of the subtype or subdimension of depression that we have studied in the last 10 years is immunometabolic depression. So we see that there is about 20 to 30% of the overall depression population that has stronger abnormalities in immune and metabolic function. We, for instance, see that these people have systemic inflammation and are more at risk for metabolic abnormalities, including lipid dysregulations, for instance. And we have also studied what is then the symptom profile we see in that subgroup. And we see in this group of people with immunometabolic dysregulations that depressed patients have more what we call atypical symptoms of depression. They have hypersomnia, they have hyperphagia, so they have the tendency to experience increase in appetite, increase in weight. They have extreme fatigue. They have lead-in paralysis. So these are some of the symptoms that are sometimes classified as atypical symptoms of depression. And I think energy dysregulation is a core feature of this group of patients. So we see a bundling together or clustering of immunometabolic dysregulations with a specific symptom profile. And the combination of this we are terming immunometabolic depression. We estimate that about 20 to 30% of individuals fulfill this specific dimension of depression. And I think this is relevant because what we are doing in our group now is we're studying this subgroup of patients better. And we're also testing specific interventions and, for instance, are testing whether either impacting on immune metabolic dysregulation by, for instance, prescribing anti-inflammatory medications for this subgroup, or testing running therapy intervention, so lifestyle stimulation in this group, whether that is specifically effective for this subgroup of patients. So I think, we need to embrace heterogeneity in research, and hopefully also give good clues for clinical care where it is appropriate to embrace that heterogeneity, also by really personalized intervention approaches.